Imagine a beam of light that could jumpstart your cells and speed up healing. Today, we're diving into laser biostimulation, how laser light interacts with our tissues at the most fundamental level.
That sounds futuristic. I'm excited to be here. We'll explore how lasers work at the cellular level, their impact on mitochondrial energy, neurophysiology, and even the practical side of treatments. Plus, we'll break down the science so it's easy to follow.
Exactly. We'll start with how lasers distribute energy in the body, move into mitochondrial activation, look at nerve and cellular effects, and finish with real-world treatment tips. Let's jump in. When an infrared laser hits the skin, about 70% of its energy actually bounces right off. Only a small fraction makes it deeper.
That surprised me when I first learned it. Around 15 to 20% gets scattered in the tissues, but what's truly fascinating is that just 5–10% reaches the cells and gets absorbed, making the real impact.
And that tiny slice is taken up by specific pigments, especially flavoprotein metal redox systems in mitochondria. They're like solar panels for your cells, converting light into biochemical energy.
It's wild to think the mitochondria are directly harnessing those photons. That conversion sets the stage for all the healing benefits we'll talk about next.
So, what happens when those mitochondria absorb laser energy? The big change is an increased conversion of ADP to ATP, the cell's main energy currency.
More ATP means more power for cells, especially for healing and regeneration. Fibroblasts and other repair cells get a boost, speeding up tissue repair.
What's even cooler is how cells that are stressed, like those suffering from hypoxia or inflammation, respond best. It's almost like the laser gives struggling cells a helping hand.
That selective effect is a big deal. Lasers don't overstimulate healthy cells. Instead, they focus the boost where it's needed most.
Switching gears, let's talk about nerves. Laser stimulation increases ATP in neurons, helping restore membrane potential by activating the sodium-potassium pump.
That leads to a reduction in nerve hypersensitivity, normalization of conduction, and, for many patients, relief from neuropathic pain. It's not just theory, it's been shown in clinical studies.
So, it's like a reset button for overactive nerves. People with chronic pain or nerve injuries often report noticeable improvements after treatment.
Exactly, and that ties directly into the broader cellular effects we're about to cover.
Laser irradiation doesn't just energize, it's also smart. It boosts metabolic rates in cells that are impaired, but leaves healthy cells alone.
That's so important for balance. Plus, it enhances protein synthesis and DNA, RNA transcription, meaning faster cell proliferation in healing tissues.
And all of this happens without risking overstimulation, which keeps the body's physiology in check. It's a targeted approach to tissue regeneration.
This makes laser therapy especially valuable in situations like wound healing, chronic inflammation, or degenerative conditions.
Let's get practical. Modern impulse diode lasers deliver peak powers of up to 150 watts, but with ultra-short pulses just 200 nanoseconds, so there's deep penetration without overheating tissue.
The dose is measured in joules per point. For a hand probe, it takes 10–20 seconds to deliver 1 joule, while a laser shower with multiple diodes needs 20–30 seconds, depending on the area.
Adjusting the energy dose based on tissue depth and the clinical situation is crucial. Acute conditions might need less. Chronic issues may need more.
To maximize absorption, keep close skin contact, or use a laser comb. Overlapping applications are smart too. They ensure uniform energy delivery across the treatment zone.
Let's wrap up with the essentials. First, laser energy is mostly reflected, but the small fraction absorbed by mitochondria can turbocharge cellular activity.
Second, it selectively boosts metabolically stressed cells, supporting healing without overstimulating healthy tissue. Third, laser therapy can calm nerves, normalize conduction, and ease neuropathic pain.
If you're considering laser therapy, your next step is to work with a provider who understands dosing, tailoring the energy and technique to your specific needs.
Thanks for joining us. Keep exploring, stay curious, and remember, the science of light is changing medicine one cell at a time.